Okay, so who is a good candidate for a penile implant? Well, we want those motivated patients. For instance, we want guys that are going to do whatever they need to do to be in the best shape for surgery so they can have the best outcomes. If you're diabetic, you got to have good diabetes control. If you're overweight, we need you to do some weight loss before surgery and do those things so that we know that you're going to be in the best fighting shape when it comes time for the day of your surgery. Now, we want those guys that have tried the more conservative therapies. You know, you've tried Viagra, you've tried the pills, and those aren't working. Then you're a potential candidate for the penile implant. And we're going to go over all the options for you. But in the end, if you want that spontaneity, you don't want to have to worry whether or not the shot's going to work. You don't want to have to carry those medications with you on vacation. You just want it to work every time and not have to think about it. Then a penile implant is a good option for you. As long as you do all those other things we ask of you to be in good shape for surgery. Okay, so many patients ask me if this is covered by insurance. Well, here in Missouri, where I practice, the procedure is covered by Medicare and the vast number of private insurance carriers. Our office always does prior authorization to make sure that we know whether or not it's going to be covered before the procedure. But if it's not, we do have some cash discounts and programs set in place with the hospital to minimize costs to those paying out of pocket for the implant. So what types of penile implants are there? Well, they're basically malleable implants, 3-piece inflatable implants, and then there also is a 2-piece inflatable implant out there as well. Most commonly we use a 3-piece inflatable penile implant. That's going to be the most natural when it's deflated, most concealable, less noticeable, and going to be the easiest to use. Sometimes people have difficulty managing the pump. Maybe they have problems with manual dexterity, or they just want something very simple, and that's when we may use a malleable implant. The malleable implant is made up of 2 rods. Think of it like a gooseneck lamp that you can mold or bend. So when you want to have an erection, you just bend up the rods, and when you don't, you can push it down over next to your leg or to the inside of the groin so that it is less noticeable. The two-piece is kind of a hybrid between the two. We don't use that very often, but occasionally if somebody's had a lot of abdominal surgery, we may think of that as an option for an implant in that individual, where we don't want to put a reservoir underneath your abdominal wall. So an inflatable implant is usually made up of 3 components. It's a reservoir that holds the fluid, which is saline or salt water, 2 inflatable cylinders, and then a pump. The pump, when you squeeze the pump, it's going to transfer the fluid from the cylinders down into those, from the reservoir down into those cylinders. And then there's a little release valve on the pump that lets all the fluid go out so that it's nice and soft and concealable when you're not using the implant. The malleable rods are basically hard all the time. It's kind of like a gooseneck lamp. You can bend it over or mold it so you can push it against your leg to make it less noticeable. And when you want to get an erection, you can bend those up so that you can use it for sexual activity. So how do you operate the penile implant? Well, when we're talking about the 3-piece inflatable penile implant, there's a reservoir, there are 2 cylinders, and there's a pump. The reservoir is going to be behind the abdominal wall, and then you have the 2 cylinders that are in the penis, and the pump down here. So when you want to get an erection, you reach down, the pump is in the scrotum between the testicles, and you just squeeze that pump, and that's going to transfer the fluid from the reservoir into these cylinders to give you a hard, rigid erection. You just keep pumping until you can't pump anymore. You'll have increased resistance there, and you can see that when you're done pumping the device, there's a good, hard, rigid erection, okay? And you can leave that up for as long as you want, whether it's 5 minutes or an hour. When you're done, there's a little valve on the base of the penis that you squeeze, and that's going to let all the fluid go from the cylinders back to the reservoir, so that while you're riding a bike, working out, anything like that, the penis is nice and soft. It's not noticeable in your shorts or in your underwear. For a malleable implant, we don't have the reservoir or the pump, we just have the two cylinders. And so basically, it would be like a gooseneck lamp. It will stay in the position that you bend it to. So if you want the penis to be erect, you can take it from down here and you just fold it up and it'll stay that way. And then when you're walking around, you kind of push it over next to the inside of the groin or the thigh. So many guys ask, is there any change in urination or ejaculation or sensation? The answer is no. Basically, this is just a hard mechanical erection. So you're going to urinate like you did before. You should, if you ejaculated normally before the implant, you should ejaculate normally afterwards, and sensation should be the same or intact after the procedure. So the three-piece inflatable penile implant is very concealable. The malleable may be a little more noticeable, but with the inflatable, you can completely deflate the device, making the cylinders in the penis very soft. Here's an example here. We see the penis is nice and soft with the device being deflated. There's a pump down in the scrotum. You can see here that is hidden between the testicles, so that if you were naked in a shower in the locker room or walking around, nobody would know that it's in there. You can go through a metal detector at an airport, nobody's gonna see anything. So it's a very concealable and natural device. So the three-piece inflatable penile prosthesis is very concealable. With the malleable, it's a little more noticeable. But with the inflatable, you can inflate the device, and then when you deflate it, all the fluid goes out of the cylinder, so that they're very soft. The penis is very flaccid, natural. You could be working out, changing in a locker room. Nobody's going to know that it's in there. Go through a metal detector at an airport. Nobody's going to see anything. It's going to be very natural. This is kind of one example of the device. We see you've got the cylinders. The penis is very soft, and there's a pump in there that is just hidden between the testicles and the scrotum. So the solution inside the implant is saline, basically salt water. It's the same concentration as the solution in all the cells in your body. So if it were to leak out of the device, it would not hurt you in any way at all. So the implant is an outpatient minor procedure. We do use a general anesthetic, meaning you're completely out for the procedure. You come in, we put you to sleep, basically the way I do it the majority of the time, and those that haven't had prior surgery or other complicating factors. We make a small incision, about 1 inch right above the base of the penis. Everything goes in through that incision. There's a reservoir underneath the abdominal wall, cylinders, and a pump in the scrotum. Everything's concealed underneath the skin. We leave a little drain in, so you wake up. We scan you. We don't routinely leave a Foley or a catheter in. We make sure you can urinate after the procedure and check you with a little ultrasound. As long as you can empty your bladder, you go home without a catheter. They teach you how to use a little drain that we use in plastic surgery that helps decrease swelling. It keeps all the fluid out of the scrotum or the sac. Just like if you twist your ankle, it's going to swell. So anytime we operate on the tissue, it can swell, and so we want to keep all of that fluid out of there. That's going to speed up your recovery, decrease the need for pain medicine after the procedure. So you go home the same day, then we see you back in about 3 to 5 days in the office, take out your drain and go over some further instructions. You need to take it easy for several weeks after the procedure, no heavy lifting or straining. And then about 2 to 3 weeks after the implant, we teach you how to inflate and deflate the device, and you start doing that on a daily basis. Most people are able to start using their implants between 4 and 6 weeks after surgery. So how long is the recovery after penile implant surgery? Well, everybody is always a little different, but in general, I tell guys about 2 weeks to go back to your normal job. The only restriction after that might be really heavy lifting or straining during that first 4 weeks, because we don't want you to get a hernia after the procedure. If guys are doing desk jobs, usually as early as a week later, they can start going back and working from a desk. and certainly 2 weeks after the procedure, the vast majority of people are back to their normal daily activities after the implant. So how soon after your penile implant surgery can you use your implant? Well, in general, we tell guys 4 weeks. So usually by 4 weeks, guys are able to start inflating the device and have intercourse. Some guys take a little while longer, up to 6 weeks after the surgery. Sometimes as early as 2 to 3 weeks, we have you start inflating and deflating the device just to get used to cycling it. And then at 4 weeks, you can start having sexual activity. So many guys ask, how long is this implant going to last? Well, really it depends on how old you are when you get the implant. The more you use it, the longer you live, the more chance there is that you may need a revision. I usually quote, especially middle-aged guys, about 10% over your lifetime of needing a revision or replacement of a part of the implant. However, many guys will have no problems with the implant in their lifetime. What are the satisfaction rates for the penile implant? Well, certainly with the inflatable 3-piece penile implant, the satisfaction rates are very high, not only for the patient, but also their partner. Many studies quote those as high as 96%. So what are the risks of penile implant surgery? Well, I like to kind of think about orthopedic surgery when you have a joint replaced. We're putting a foreign body in your body. So there's about a 1 to 2% chance of infection depending on whether or not you have diabetes or other risk factors. All of the devices are coated with antibiotics to help prevent that, and we do some no-touch techniques and make sure we optimize your diabetes and other risk factors before the procedure to help minimize that. It is a mechanical device, so there's always a small risk of part malfunction. Usually quotes you about 10% chance over your lifetime, especially if you're younger at the time of your implant surgery. There's always a small chance of injury to things around where we're working, whether it's the urethra, the tube you pee through, bladder, or other organs. However, everything we're doing is outside of the abdominal cavity, so it would be very rare to have any issues placing the implant. There's always a small risk of pain, especially right after surgery. However, as long as the implant is sized correctly and placed in the right proper fashion, it'll be extremely rare to have any pain after you're all healed up, especially after 4 to 6 weeks from the time of your surgery.